This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo! Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. The Speaking of Pets podcast is sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. Hey everyone, welcome to Speaking of Pets. I'm Dr. Alice Novotny-Jerome, a board-certified veterinary dermatologist, and
I'm Janet Novotny-King. I'm the doctor's sister, and I am not board medically certified, trained in anything but CPR on humans. I could probably do a pet. But we are excited today because we have a return guest. So
our favorite veterinarian, and I want him to be my vet, Dr. Jeff Powers, even though he's a Michiganer, we still love him. And the reason I asked Dr. Jeff, to be on today is we've had a lot of questions about CBD, and we want to talk about the controversy going on about veterinary expenses. So Dr. Powers, to me, is the authority on CBD. He was head of the committee for the AVMA when we were on the Biologics and Therapeutics Committee together to gather as much information as we could about CBD so they could come out with a statement. So welcome, Dr. Powers. Good to see you again.
Good to see you again, Alice and Janet, and it's an honor to be back with you again on Speaking of Pets podcast.
Well, and we know will get you everywhere.
Yes, it will get you everywhere. We know Dr. Powers is in the middle of seeing patients, so we're lucky that we have him for the time we do. But Jeff, I wanted to mention a couple of facts that I was uncovering about CBD and get your comments. One paper mentioned 60% of pet owners are using CBD for their pets. And to me, that's a lot of people using a supplement that really a lot of people don't know much about. And can you comment on that?
Yeah, that's definitely the case. I think CBD for people and pets was a big buzz a few years ago, and there was a lot of publicity about it. There was a lot of discussions about it. And what has happened is use has quietly increased, and the public awareness and knowledge of the facts around CBD have not increased that keep up with the use. So it has become pretty much mainstream, like you say, because people are many times interested in trying more natural or more, say, herbal treatments, or perhaps milder treatments that are less toxic to their pets' organs. And yet, unfortunately, many times they are unaware of proper doses. They're even unaware if CBD is even in the products that they are giving. So
good point.
The question is, there's human CBD and there's veterinarian CBD. I'm going to call it pet CBD.
So that's a good question. And sometimes you can. If you can base things on milligrams. The problem with that is many times the human products may have artificial sweeteners, things like that could be potentially toxic to dogs. So the other thing is, the concern is that people quite commonly, it's one thing if they're getting CBD, a lot of people will go to dispensaries and get products that have CBD in them, but are in many cases have higher levels of THC in them. And so they may think, oh, it's got CBD in it, I can give it to my dog. And the thing is, dogs, because they have a higher concentration of receptors for cannabinoids in the brain than people do by weight, they're even more sensitive to the effects of THC than people are. So the problem is they can get overdosed on THC, and they could also have blood sugar abnormalities, things like that, if they were taking the wrong product. So it is very important to try to stick with something that is for pets.
And where do I go? Do I go to my veterinarian? Like, where do I get that as a pet owner?
Well, that's a good source. An increasing number of veterinarians are more aware of CBD products that are available. Some may even carry them in their veterinary clinics. So that's one good source. Um, that is, you can also search out companies online that may have presence. But what's important with is that you look to see and make sure that you can go to the website of the company and that they have this what's called the third party certificate of analysis. And what that will do, it will show you how much is actually in the product of CBD in the unit of, say, it's a treat or a tincture or something like that.
So be careful as a pet owner, right? Be careful.
Yes. Oh, buyer beware. Because Jeff, does every company that puts out a CBD supplement have that guaranteed analysis? I mean, that seems to me like it would cost extra to do that, and that would be a better company then.
Yeah,
Or am I wrong?
it does cost extra to do that, but it it's really to be able, so like one check in the system is that companies that will allow you to like use their credit card processing system will not allow you to use their system unless that's one of the check marks that certificate of analysis are clearly available to the customer.
Oh,
There
interesting.
needs to definitely be more regulation in this area, but
Mhm.
it is increasing that those products do have that on there. Many times you have to look for it, but that's one good way of telling. Also, if a company is a member of like the National Animal Supplement Council, like a lot of CBD companies are, they ensure some level of standards that help you know that what you're getting is what is actually in the product. I mean, I run into this all the time where people will bring in a product or they'll tell me their pet's on CBD. Most of the time, they're vastly underdosed. Um, they're giving a product that they bought that has almost no CBD, and I know people will say they bought their CBD on Amazon, and what's on in those products, Amazon, there is no CBD products available for oral use in pets. So a lot of times they'll have what's known as hemp seed oil.
Mhm.
And hemp seed oil, yes, it's nutritious and it provides some benefits that way, but it doesn't have any of the cannabinoids, the active molecules that are of which CBD is the most beneficial for pets.
So it looks like the public thinks that hemp seed oil and CBD are the same thing
Yeah, so
when they're not.
you got that triple paradigm almost. They'll think, well, there's THC in there, and that may be okay because it says it's got CBD, and then yeah, and then the opposite spectrum is it's got hemp seed oil, which may help their coat shine a little bit, but that's about it.
Now, I've had people, even though I'm a dermatologist, I've had clients email me. We've had a lot of storms in Ohio, just like you have in Michigan. Janet, you're getting it tomorrow in Connecticut. Ask me about, can I use CBD for thunderstorm phobia? Would you comment on that?
Yeah, CBD actually, I have a lot of people that give that, and I give it myself to dogs. But it does work very well in calming them. The problem is you kind of have to anticipate things a little bit. So if you know a big storm's coming, you want to give it about an hour or two before the storm
Okay.
or even before, because pets, I think they sense the pressure changes just like we could feel pressure changes. I think they're even more acute to those changes. So it's best to have that. Say you're going to have some stormy weather for a few days, just give a dose like about a milligram per pound. Give it like even twice a day, and give one of those doses an hour or two before the event, and it works fine. If you wait to give it till right when the storm's hitting, it's just like even any other sedative. It just sometimes gets overridden by the fear.
And
Fireworks,
pets
you want
almost
to give
tell
it
us.
Well, you want to give
Oh,
it
I,
at fireworks too, right? It's
that's a
kind of
good
like
point
when
for,
you have surgery, staying ahead of the pain, right?
Exactly. Exactly. A
Yeah.
couple hours
wow.
before fireworks is the same thing. A couple hours before vet visits is the same thing.
Yeah.
There's a
So
lot
what
of
are
what protocols called like chill protocols where you give dogs some mild sedatives to come in. And actually, we've added CBD to our chill protocol. And it seems to work really well in a lot of cases as long as you give a higher dose. You have to give a higher dose a lot of times in this high stress situations.
so what are you giving for patients? So it's vet visits, thunderstorms. What other medical reasons do pets take
Well,
CBD?
there's been several research papers done that shows its benefits in reducing inflammation and pain in osteoarthritis. And you may have heard there's like this one of the ways it works is similar to there's a drug that's given to dogs for arthritis now via injection, and it can treat pain. And it also CBD actually works in a little bit safer but similar method on calming the nerves down. So people, we have a lot of people. I have some people that purchase our hemp products for rheumatoid arthritis as well, because it's very good at calming neuropathic pain. So that's another area. In seizures, there's been research that shows that CBD will reduce seizure frequency by about 50%. I think many of us are aware of Charlotte's Web, and Charlotte was that was a company that really started the CBD boom, because there are some rare seizure disorders in children where CBD is the only thing that can stop the seizures.
Wow. In this, there was a really good paper out in 2016 about consumers' perceptions of use of hemp in animals. And the four most common reasons people were using it were seizures, cancer, anxiety, and arthritis.
Yeah.
Yeah, you hit on all four of those, right?
Yeah, definitely. We
So
have
can you
we have a dog with terminal cancer right now that we put on a high dose of CBD, and not that it's curing the dog, but the dog's quality of life seems really good.
Well, you know, Jeff, there's actually a written published report in the National Institutes of Health that reported that, among other benefits, CBD has been found to kill cancer cells without harming healthy cells, which I was not aware of that report.
Yeah, that's an interesting report. I'll have to take a look. I know there's been certain types of cancer cells that it has been proven, like in lab studies, to be effective on cancer cells.
I just worry about pet parents buying any kind of CBD, because in this paper they also said they looked at 75 products and only 17% had in them what was on the label. So pet parents, you've got to stick with a reliable company, and like Dr. Powers said, make sure there's analytical data to support it.
Yeah, and I think that's an area even the hemp industry is trying to work on, because part of it may be, marketing and sales, and part of it may be that even the labs aren't standardized to the levels that they need to be. And this is where the Congress has asked the FDA to get more involved in regulating CBD, and they seem to have every reason under the sun they're trying to pigeonhole it as a drug and like an individual molecule, and it's just not that, because it's more of like one of nature's best herbal supplements is really what it's like. And even because I've been growing it now for about 8 or 10 years for our hemp plants that we make our own product, so that's one way I got into it, to trust what we had. And every year there'll be little differences. And usually the CBD levels will be similar, but they'll be like the minor cannabinoids like CBC or CBN or CBG, which all can be beneficial, but there'll often be little differences. And maybe that was caused by the weather Maybe that's caused by levels of we're using an organic fertilizer, but it's a plant, right? So it's just like your corn plants and tomato plants, they're not identical every year. The same thing happens with hemp.
And that's Beaver Island hemp, by the way, for all of our listeners.
Yeah. Yeah, that's our very,
And they make a chew.
we make our these chews are far and away our best seller.
Yeah, yeah.
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems. They make a food allergic diet that's an alligator-based called NP or a hydrolyzed salmon-based for dogs and cats called HF. So please ask your veterinarian about Blue Buffalo prescription diets.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry, and I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
So if my pet is on other medications, is there any interference?
There are some seizure medications. That's a good question. There are some seizure medications that can interfere with CBD, because CBD does work on metabolism in the liver. And actually, that effect can sometimes be beneficial, especially if they're on like a anti-inflammatory medication, because sometimes it'll delay the breakdown of, say, carprofen or some of the other anti-inflammatories, so you could potentially get by with a little lower dose. We have a lot of clients that give their dogs CBD pretty regularly, and then occasionally will give an anti-inflammatory versus relying on the anti-inflammatory alone all the time. It's a good idea always to check your pet's liver and kidney values anyway if they're getting these products, and because it can slightly raise some of the liver values, the alkaline phosphatase, but over time it tends to self-regulate, modulate. It never seems to build to a toxic level, and I've checked that hundreds of times.
Have you ever had to take a patient off of CBD for any?
I've had some more for GI. I've had some that got diarrhea. Maybe, and that would be the biggest one. We were using a lot of tinctures before, so maybe it was even the oil vehicle. The diarrhea has seemed to reduce with the chews, but I still have seen a few cases where and maybe that's not even the CBD, maybe that's an intolerance to something in the chew. I don't know, but it's pretty rare.
Okay, good to know.
So, okay, I'm thinking, Alice, you're an allergist, a veterinary allergist, a dermatologist. And if, say, my pet has seasonal allergies, grass allergy, I'm making it up, would they have any reaction to CBD? Do you see?
Well, the one, and Jeff, you probably know this, the one study that was done using CBD for allergies helped with the itch, but it didn't really help with the inflammation that goes along with it. But you know, I'm as Jeff and I both being veterinarians, I'll take anything that's really not a drug that helps my patient, you know? And also the main side effect can be a little bit of sedation. That's not too bad when you're trying to sleep at night and the dog's trying to sleep at night and they're up at 2 a.m. Yeah, licking. What about cats, Jeff? Do you have many cats on CBD?
We have some cats. The biggest problem with cats is getting them to take it.
Janet.
Would it make my male cat like me? Because we have an issue.
I mean, there
Yeah,
are
that's
some cats that will eat it, but I mean, we've been experimenting with some flavors, but it's tough because, you can put it on their food and they'll reject the food. So,
Yeah.
I'd say, 90%, 95% of what we're doing is dogs. I know there's a movement now to do more with horses. I haven't personally had experience with that.
That'd be a
What is
big
the,
dose.
is it a bitter? Yeah, that's a big dose. Is it a bitter taste that you're trying to disguise? What is the taste of it?
So a couple factors. So when it's the raw plant, the CBD is in the form called CBDA, which is an acidic form. And actually, the CBDA acidic form is really good for it's a stronger anti-inflammatory than CBD is alone. However, the drawback with it is acidic. So it's like taking a little bit of acid. And so it will make them reject it a little bit. We try to do a process we do a process where we heat the plant to a certain level, and it breaks down into CBD from CBDA, and then it's more palatable. Definitely, a pure like CBD extract really doesn't have a lot of flavor to it. It may have a little earthy flavor, but that's about it. But so it's on one hand, I think it's a little better. CBD is a little better for sedation, calming, and it acts a slight bit different than the CBDA. So a blend a lot of times is what we shoot for, close to a 50-50.
That is so interesting. That because you could, as an like for arthritis, you could do more A, and less of the one that's sedative. That's fascinating. I had no idea that there were so many specific differences there.
Yeah,
So
I have one lady on the East Coast. She buys our tinctures that are high in CBDA because she said that's the only thing that controls her rutaid arthritis.
Wow.
Wow.
So Atticus, Catechus, the cat, I'm thinking salmon.
Yeah, we do have salmon
flavor.
flavor oil, and we do sell quite a lot of that.
Oh, look, there it is.
So
I love it.
I didn't know if you were going to ask about it, so I brought it.
No, I'm glad you did. I'm glad you did. Now, can you talk dosing, Jeff?
Yeah.
Is the dose for arthritis different than the dose for seizures, for example? And we understand we're not giving doses here to
Right.
people, but I'm just
Right.
wondering, is there a difference in the amount you would use for one disease compared to
And
another?
we all know it depends on the patient and the
Yeah.
size, etc.
Yeah.
Right.
So
and anything else they're on.
the research dose for arthritis was around 2 milligrams per kilogram, or let's say a milligram per pound. There's been some studies showed that it worked at a lot lower level. And that's probably just the bioavailability. Everybody absorbs, and every pet absorbs CBD differently. So for seizures, usually you're given a little higher dose, maybe 2.5 or 1 milligram per kilogram. And so it's all really, if you can remember that milligram per pound dose, that's a really good starting point. Sometimes, especially on a little dog, I'll recommend maybe start a little low, even half a milligram per pound, because every once in a while, like you talked about the sedation, every once in a while, you'll get a pet that gets really sedate at a lower dose. So that's good in a way. They don't need as much. So
Now, I know that you see, as a general practitioner, I know you see dogs, especially that come in that have ingested marijuana that their owners bought for themselves.
right.
Would you comment on that and why that isn't a good idea to do that for your dog?
And it could be accidental.
Oh, it's always accidental. Ask
Yeah.
Jeff, and it's always the roommate.
Yeah.
Yeah. It's never them. There's no way
Or the
that
other
they
dog.
could possibly have it, but they have it. So, I mean, but actually it's funny because people are now getting more forthright with that, I think.
Good.
And so it does make it a little easier. But yeah, so what happens is, as I said earlier, dogs have more THC receptors in the brain, cannabinoid receptors, CB1 receptors is what technically, but than we do per pound. So when they get ingested, then they can get very sedate. Usually it causes a slow heart rate. Often you'll see them come in, they're just sort of staggering around. They may be leaking urine a little bit. I've seen some cases, most cases I've seen have been, not life-threatening in any way. The only time you'll run into a potential life-threatening case is I had one case years ago where the dog was an old dog with a bad heart, and it was totally collapsed, and its heart had slowed down to the point I had to give it stimulants for several hours while we were getting the fluids with some lipids in it to try to get that out of their system. So
Did he make it?
Oh yeah,
Oh,
made it. But I had the only case I heard, a veterinarian in Colorado told me once that he had a case where a little miniature poodle ate a vape cartridge, and that's the one thing you gotta, those concentrates, that's where they can really get a heavy dose easy. And I've seen that also happen where they're not eating the gummies that the people are eating. Like people are making their own marijuana butter, and then they throw the leaves out in the yard, and what dog thinks it's butter. And so what dog isn't going to eat a stick of butter? And then they get super toxic reactions.
Janet, could you even imagine? I mean, Jeff and I being as veterinarians, this is kind of commonplace. Could you even imagine some of this stuff could happen?
Yeah, because I've worked with the general public for a lot, and I've had some
that's true.
questions.
That's
true. Our favorite, our family, there's an ice cream shop on Nantucket. Every day they put up the stupid question of the day. And the stupid question of the day when we were there was, is the ice cream cold?
Yeah.
So when our family, there's a stupid question, we'll go, is the ice cream cold today?
Got it.
Because I can't imagine someone putting CBD in butter. I can totally wow.
Brownies, but they're not supposed to be giving the dog chocolate anyway.
Right. And that can in fact that can happen a lot, and then they'll get a chocolate toxicity plus a marijuana toxicity.
They don't even each other out, right?
Right.
The slow heart rate with the CBD and the high heart rate with the caffeine.
Yeah. The only last thing I'll say about THC is that it's not a totally bad, because low doses have been found to be very helpful in cancer pain in dogs, because it is THC ounce for ounce is a stronger anti-inflammatory analgesic than CBD, or even cortisone is. It's 20 times as strong as cortisone. So there is a future when all this regulation gets sorted out for some products for pets that have slightly higher THC levels, just to help them more with pain.
Wow. And wouldn't that be nice? Oh. Before we switch topics, I just want to mention Beaver Island Hemp, and I don't want to embarrass Jeff, but I totally trust his product. I see how hard he works at it and his knowledge of it. So Beaver Island Hemp.
Blue Buffalo Natural Veterinary Diets offer a natural alternative in nutritional therapy. With their in-house research and development team with over 300 years experience in well pet and veterinary therapeutic diets, more than 600 scientific publications, and more than 50 U.S. patents. Blue Buffalo Natural Veterinary Diets.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry. And I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
Now, Janet, you're going to have to reel in Dr. Powers and me because we want to talk about veterinary costs and why they've gotten so high, because Dr. Powers and I are both independent practice owners. We are not corporate, and we see what's going on, and it's very disheartening. So, Jeff, I'm going to let you take it away.
Well,
I know
the
AVMA.
patient, the pet owners see it too, because your local pet office becomes
Right.
VMA, or I'm using that name because it's low. We have one here, but all of a sudden, your doctor is part of this conglomerate, and everything changes.
Yes, yes, that's very true. And AVMA has made a statement on this, and Jeff and I know AVMA well. But sadly, in that statement, there aren't many suggestions as how we're going to fix the problem.
No.
So the problem is the corporations, correct?
Well, I think that's one of the problems. Jeff, what do you think?
Yeah, well, I think that's, you've had a convergence of factors. You've had definitely the corporate influence came into veterinary medicine, maybe what started, well, it was always there at a lower level, but the last 10 to 15 years, it's really taken the profession, and clearly with the goal of really pretty much taking it over. Private equity looked at the veterinary profession and said, here's a business with a bunch of very caring people who are very good at taking care of pets and are very poor business people. And really they chastised, made fun of veterinarians, and basically came in and took control of businesses. And now you have MBAs pulling the switches and the levers. And the problem is that the clients are left in the dust because now there's all these protocols and all these costs and increased costs associated with how veterinary medicine is delivered. And you talk about, Janet, about dealing with real people. A lot of people just can't afford that. And so there, for a while, it looked like the independent veterinarians were just going to fade away. There is some hope now because there are a lot of younger veterinarians, or a fair number of younger veterinarians, are starting to look at independent practices more. And as these corporate practices turn over and mature, they find that they're not the panacea that they promise that they are.
Yeah.
letting the dog
And a quarter of the USA's 30,000 veterinary clinics are now owned by corporate, and specialty clinics, it's 35%. And I get that about specialty clinics because they have MRIs and all these advanced technology things that it's hard for an independent veterinarian to afford. But having said that, I love our increased technology. I love it, love it, love it. But what I always think in the back of my mind is, if I order this $5,000 or $10,000 test, is that going to make a difference in the outcome of this patient? Just because I can do something doesn't mean I should do it. So it's very frustrating. I know the practice I did an internship at, they were bought out by a corporate. Immediately the prices went up. We had a fallout of clients that scrambled to search for other places to go. And I will tell you, 2/3 of the veterinarians left.
Yeah, that they're finding there's a lot of turnover at those practices, although they are still very successful at attracting the young graduates, because they'll often lure them with large signing bonuses that make it very difficult for practicing independent veterinarians to keep up with the cost. And like you said, the costs skyrocket. And so we went through this little period with COVID where people had a little more money and they had a little less other things to spend their money on. And that just sort of fueled the flames of this. And everyone thought, well, we can keep raising prices. All the suppliers, they can raise prices. I know there's a lot of talk now about on the national level and about human medicine, about how drug prices are ridiculous in this country, but the same drugs you could buy in other countries for much lower. Well, the same thing is true in veterinary medicine. And the other thing that's true is a lot of these corporate clinics, they're buying these products 50, 60, 70% less than the independent veterinarians can purchase them for. So that
And that, why is that? These drug companies know that they're selling that product at a cheaper rate to these big conglomerates, if you will, and then you and I are independent practitioners and we get charged a higher fee.
yeah, and I could see a 10% difference or even 20% difference as being, it's easier for them to ship or whatever, or easier to get paid from one company, but not 70%. The thing is, these don't translate in many cases into any less expensive cost to the consumer. These corporate clinics are making huge margins on these products that's going to feed their corporate clinic.
Wow, I'm just reading a Gallup poll. 52% of pet owners skipped vet care in the past year due to cost.
Yeah.
Right. So
And that's tragic.
increasing again. With that trend, it started to reverse, and now it's gotten to the point that it's going back the other way again, which is sad.
It's so sad and so tragic. Dr. Biggie, who was an internal medicine specialist on the show, a friend of mine, her dog had pancreatitis, took it to one of the specialty hospitals here, $4,400, 24 hours. Now, it did get the new drug for pancreatitis, Jeff.
Right.
It got 2 doses, and that was like $300 a dose. But as soon as it stopped vomiting and felt better, she said to her son, go pick up that dog.
Yeah.
That dog home.
So,
Well, she's a
it's-
veterinarian and can take care of that dog. Me, Joe, pet owner,
Right.
Do
I would be,
I
have him
know.
skip another night,
It just breaks my heart. It just breaks my heart because I know that these young vets, when they get out of school, they really want to help, and they're getting into kind of a web that it's hard to crawl out of.
Yeah.
Well, and
Well,
most likely they have debt, right?
That's true.
Yeah, and
They
that influences a lot of their decision where
Yeah.
they go work. And like you were talking about that situation, it's just the level of medicine now. We talk a lot about standard of care. Dallas and we've had to do standard of care for our entire career. We had people that wanted every last thing done for their pet and could afford it. And then we had people who, barely have enough money to put food on the table, and their dog has the same disease. And so you come up with a way to treat the pet as effectively as you can with a lower cost. And that's a new phenomenon for a lot of younger veterinarians, because they're told if they don't use the absolute best methods and practices and protocols that are expensive, that they're going to be in trouble. And so the pets end up with a lot of sadly get euthanized because they can't afford, by the time they even get through the workup, they've already exceeded what the people can afford to keep the pet.
I agree. And as a specialist, I was always told I was held to a higher standard as far as malpractice insurance goes. And yet my goal was to treat the pet without spending all of the owner's money. I mean, to try to get it better with spending the least amount of money, but yet I could get sued for that.
Yes, definitely.
So I'm assuming, and I'll ask the doctors, it's a good practice for a pet owner to do those annual visits because you're staying on top of the pet's health rather than wait until they get super, super sick when your costs are going to be higher. Am I assuming the right thing?
Definitely. it's best if they get examined every year, and as they get older, sometimes we'll recommend blood panels and exams, even every 6 months, or certainly if they're on medication. But you're right, it's just like your own health. If you can catch a problem early on, it actually will end up, probably you'll have a better outcome, and then you'll also probably save cost as well, because there won't be quite as many drastic measures that'll be needed.
And Janet, I know that you recently enrolled in pet insurance for Libby, and I think pet insurance is a good idea, but we had a pet insurance expert on, and you have to really read through those policies, make sure they cover cancer, make sure they cover accidents. I mean, you have to cross those T's and dot those I's, because they can be very specific, where you've paid so much a month for all this pet insurance, and then you come to need it. Oh, wait, it didn't cover that.
And I understand too that,
Yeah.
go ahead.
Yeah. Well, no,
I
I mean, I
understand
did so
too.
much research. It was insane
Yeah.
to pick a pet insurance company. But go ahead, Dr. Powers.
Oh, I understand too that because of the overall costs of veterinary medicine have continued to be driven up, that the cost of pet insurance is going up as well.
Yeah.
Well, Janet, what was your policy? How much are you paying?
For Libby, who's 4,
Mm-hmm.
it's $113 a month.
And you have no declared previous illnesses. That's a biggie.
Yeah.
That's a
Okay.
biggie. And I did have to send vet records. And then I went for, I think the deductible, I did research on like what's a fair amount. I forget what the deductible is. It's not like 10,000, right? Because that didn't make sense to me. I think our deductible is around 2,500 to 5,000.
Okay.
But you could pick the deductible, and because of what we went through with one of our Goldens, plus every time I told a vet I had a Golden Retriever, they were like, oh, like
Yeah.
testing for cancer. So that's the reason we got it.
I think probably cancer and hit by car, it might pay off to have
Yeah.
insurance. What do you think, Jeff?
Oh, I would agree. Yes.
Okay.
And it's funny because I ran into a friend who's a dog person. They've had multiple rescues. And she said, we just decided not to do pet insurance and to put that money aside. So in case we do have a big
Oh,
expense.
sure.
But if you calculate out $120 a month, right? Times 5 years,
$1,440 a year. That's $1,440 a year.
right? But times 5 years, what if I get a $10,000 vet bill? That's still more
Oh,
than
I
the
see.
5
Right.
years. And that was
Yeah.
how my business brain calculated it out.
Mm-hmm.
A worst case scenario, if this
Do
happened.
you see much pet insurance, Jeff? Do you see many patients with pet insurance?
Not very much. Probably 5%. We're in a lower middle
Yeah.
class area though too.
Yeah.
So
I did, but as a specialist, I didn't see many at all. And I have to tell pet owners that, for example, let's say you golden retrievers, because they're allergic.
Yeah.
Like Janet's dog, I have 2, they're allergic. Okay, so if in my 4-year-old dog, if I go to enroll in pet insurance today,
Yeah.
and they see in that history
Yeah.
that she was on Apoquel or prednisone or something for allergy, they're going to call that pre-existing. Maybe it wasn't for that. Maybe it was a bee sting or something. But you've really got to watch in the previous history, because they'll shut you down
Yeah.
as far as, oh, we're not going to cover her. She's allergic. Look in her younger days, when that might not have been true.
Well, interestingly, when I called my vet because I had to get the medical papers, they were like, "Oh, sure, we have their email. We'll send it right off." Like it was commonplace to them.
Hmm. Yeah,
oh,
yeah,
yeah.
It was interesting. So
yeah. Wow.
I know.
Well, Jeff, do you have any advice for people that are watching? I mean, so many people love, it's unconditional love. We all know that, for their pets, and they want the best care they can afford. But do you have any suggestions on how to deal with these rising costs?
I guess, the one thing you could do is try to spend some time looking around. If you're going to a corporate veterinary clinic and you're happy with it, then, and the veterinarians, I think finding a veterinarian that you can trust is probably one of the best things, whether they're independent or corporate.
Right.
That's really one of the fundamental things. And don't be afraid to ask questions, and and get an understanding of what your pet's medical needs are from your veterinarian and ask for your suggestion. I mean, we have a dog in today with a fungal problem or a nasal problem that may have a fungal infection in the nose, and that client wants everything done and can afford that. And we did x-rays and we can see some opacity, so hopefully it's not a tumor, but
Yeah.
and then we have others that can't afford it, so that we'll do the best we can for in the situation as the situation allows. But I think that's probably the best. And sort of as Janet said, don't skimp on the preventative care, because that a lot of times will catch a problem earlier, like your allergy cases. I had a client yesterday. I actually sent you a picture of a. She said,
Oh,
"Well,
he was very cute.
when the dog is on the Apoquel, there's no problem, but we just ran out and we just forgot to give it. And then 2 months later, now we've got some serious secondary problems. And so then you end up not only treating the allergy, but you treat all the other problems that are involved, which can get expensive, especially if you get resistant infections and things like that. So anything you can do to stay on top of it will save you in the long run.
So true.
Kind of
So
like
true.
your dental cleanings twice a year, right? They're preventative, right? It's preventative care for humans.
Right. And
I
Right.
also just, as a pet owner, I feel better when I take Lib or the cats, and they check them out. Everything's good. They're looking good. It's you feel like whew, everything's good for another year. It's
It's
comforting.
peace of mind.
Yeah.
And what price peace of mind? Yeah.
Right.
And dental disease in pets is definitely a biggie as well. The earlier you can stay on top of that and keep it to a minimum. I know we try, if we have a pet in for any reason at all that needs a surgery, we'll always look at the teeth, because sometimes it may be a younger dog that has a growth or a laceration or something, and we can get an early cleaning in, because
Yeah.
the earlier you do it, you get less gum loss, which leads to less bacteria, and which ends up saving the organs in the long run. So
Jeff, that reminds me, in general practice, whenever we would have a pet under, we'd always check the mouth. We'd always do the nails.
always.
Oh, so many times. I've had my dog at the specialty clinic for whatever. And I'm like, oh, they'll probably do her nails while she's on. I'm not going to mention it.
Yeah.
No, nobody does that anymore.
No.
Well,
Like-
I always mention the nails because I don't do that.
Well-
I'm
I know, but
scared.
Janet, you never had to mention it before. That's my
Oh.
No, we do free nail trims on any surgery patient.
right. We're like we old vets. We do that. You got them under. Let's get our mileage out of it.
Yeah.
Clean those ears while he's under too.
Yeah, absolutely.
I got to share a customer service story because I had to go for a procedure this morning, and it was fasting, and I got there at 7:20 because my appointment's at 7:30, and the door's unlocked, and I go in, and another lady comes in. So it's me and my husband. Then this lady comes in with her husband. So there's 4 of us there. You can hear everyone in that human practice, it was radiology, in the back talking about, what'd you watch last night? That whatever, coffee talk, it's fine. And at 7:37. Oh, there are patients out here. And I'm like, well, if you have a freaking 7:30 appointment, what were you expecting?
That's human medicine. In veterinary medicine, they'd be pounding on our door.
Wait, and
Or the
P.S.
dogs would be going at each other in the waiting
And
room.
P.S. They want you to get there 15 minutes early anyway, right?
Yeah.
So I'm standing there and she goes, are all of you patients? And I go, we don't know.
Jeff, I have to tell you,
I was gonna
Janet's
die.
been having this chronic problem since she went to Italy, and she was on this antibiotic. She had a drug reaction to it.
Horrible,
and the poor thing,
horrible, Jeff.
she
Like, I thought I was
she
gonna
texted
die.
me, and she said about medicine, and I said, yes, human medicine. That would not happen in veterinary medicine.
And you know
we
what
would
they
call
said?
you back.
I had a fever. I had all this stuff going on for 2 weeks. Couldn't get off the couch on this medicine. And you know what?
And you called the doctor.
Twice. So wait a minute. Here's what I got. Oh, you had a virus. And I'm like, no one's going to blame it on the pharmaceutical. And
Yes.
let me tell you, it was the pharmaceutical.
So you got
Yeah.
worse
Anyway, I'm
on the
not going to go there.
medicine.
And one more
That's
thing you were
better.
talking about. Oh my God.
Oh, she did.
So I take this
Her
for
liver
my
enzymes went up and
analysis.
everything.
It's the sac of blah, 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 blah. It's sac.
Oh yeah, it's a probiotic. Yeah.
The
Okay.
only company I'll buy from is Orthomolecular. Now, interesting, because that's where my chiropractor gets it. Interesting, when I order it online, Amazon used to carry it, and they will no longer let Amazon represent their product.
Interesting.
You should check Consumer Labs about that brand.
Yeah,
by the way.
definitely.
I will. But anyway,
See, that, and we're not talking microbiome, but I want to run this by Jeff real quick before we go. The thing about microbiome, it's totally fascinating. I totally believe it. We just don't know how to fix it.
what's microbiome? Oh,
What you're taking a probiotic to
I don't
hopefully
understand, but it's supposed to
reset
work.
your microbiome.
Yeah,
But we don't know how much of that you should take. I think it's a great study,
right.
but we haven't gotten to the point where we know how to fix it.
Yeah.
It definitely helps on a lot of pets. I know with diarrhea, we've been using a lot more probiotics and like GI biome diets that are
Yeah.
designed to help. And it just makes sense, especially if you're on medications that we know are wiping out those essential and beneficial bacteria to supplement and try to get those things going again, because your gut is so critical to your overall health.
Janet, you're perfect example of that.
Well, and
2
honestly, I had
years now.
Lyme and Bartonella, and when I went on the two major antibiotics, which like they overlap and then they don't overlap, I had to send away for some, and I don't know what it was, some special probiotic. And that probiotic made a huge difference for me when I was on those.
Thank God. Yeah.
It was,
You
and I was
talk
like,
about-
I'll do whatever you tell me.
You talk about Lyme's disease. We had a dog come in last week, was positive for Lyme's, anaplasmosis, and ehrlichiosis.
Oh, that's a
And
bad one.
I always thought Ehrlichia was, Ehrlichia canis is a disease you'll only get from brown dog ticks. I don't think deer ticks will carry it. Well, then I talked to a client, and she had anaplasmosis and ehrlichiosis up north here, and from a black-legged tick. So I researched it, and apparently there's a strain of Ehrlichia that deer ticks carry as well. And she was very, very ill, but she said once she got on the doxycycline, within a few days, she was way better.
Hey, she was lucky they actually diagnosed it.
Yeah,
knew
it
what it
took a
was.
while, she said, for them to
Because
figure it out.
The normal person goes to 5 to 7 doctors before they get diagnosed with a tick-borne illness.
I did.
Oh, don't get us started on that.
Well, and
have
she
a-
said they still don't. She said they're all surprised that she hasn't tested positive for Lyme's. So they're retesting her this week for Lyme.
Depending on which test they're using, right, Janet?
That's right. So wait,
Yeah.
we have, I'm in Connecticut, and the Northeast has a huge rise, and I'm going to mispronounce it. Babiosis.
The BCOsis.
Babesiosis, yeah.
And my very good friend just got it, and she was diagnosed, and they put her on the, what's the thing you get from mosquitoes? No.
They put her on doxycycline?
No, what is she? She's on, oh my God, you have to take it when you go to foreign countries. It's
Quinine
malaria.
or
She's on the malaria drug,
anti-malarial.
Oh, quinine.
anti-malaria,
anti-malarial.
and antibiotic.
Chloroquine.
Or
Yes, and it took her. She lost 10 pounds. It's been about 3 weeks. She's better now, but not great. She's so tired.
I can't imagine how many tick-borne illnesses are at the root of illnesses in people. Really, and it's not diagnosed.
that's
Well, they
way
tested me.
underdiagnosed.
They tested me for lupus, MS, you name
I
it.
know they wanted to put you on steroid. I remember you called me crying. I hear you. Wow.
And the doctor was like, "You're my only patient that won't go on the steroids." And I went, "No," and thank God I didn't, because it would have only made the Lyme worse. So anyway, that's a whole.
Does it
nother-
relapse? Does it relapse periodically? I've talked to people where they say they have relapses of severity.
No, I have not had a relapse of Lyme, but what happened with Lyme was I have polymyalgia rheumatica, PMR, and I just had a flare up of it. Probably about 3 weeks. I'm better now, but that will continue to flare up my whole life because the Lyme brought it to the surface, dormant. And they're also finding now there are studies they're finding that flare ups of PMR are related to the COVID vaccine.
Okay, and let me tell you what I just read this morning. on one of the medical reports I get every day. COVID vaccine activated metastatic breast cancer and lung cancer cells, and they proved it in mice.
Oh, wow.
So, Dr. Powers, this is always a pleasure, but it's so informative and helpful, especially as, Joe pet owner here, because it's just really helpful. Thank you very much. Thank you.
And Janet, you're good because Jeff and I would just talk and talk and talk and go on forever. So I appreciate your good questions that you asked today.
Yeah, it was a pleasure to talk to you all again.
Oh, Jeff, it's great seeing you. Tell Beth I said hi.
I will.
How's your new golden, by the way?
A little crazy, but she's doing good.
Good.
Yeah.
Good.
I think golden and crazy go together.
16 months old, lots of energy.
Oh, yeah.
Oh. Well, anyway, Janet, let's wrap it up. This is Dr. Alice Novotny-Jeroman from Cleveland, Ohio.
And Janet Novotny from Cleveland, Ohio, saying thanks for listening. Don't forget, extra biscuits for your pets, extra love, and thanks for listening. And
don't forget Beaver Island hemp.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts, because we love to have those likes. Thanks so much for listening.
That's actually really good. You could both go bye-bye.
Bye-bye.
Well, yeah.
How about woof woof?
This episode of Speaking of Pets podcast was sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family.
Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.